Hello, I'm Dr. Beth Taylor, the Mayor of Wytheville, Virginia, your mayor, and I am here at this time with a very important message for all of our citizens. And first of all, I really want to tell people not to panic, but just do as you're asked and do the right thing, and we will all get through this together as a community. The town of Wytheville is deeply concerned about the health and well-being of our citizens and businesses. In order to help mitigate the spread of the COVID-19 virus, also known as the coronavirus, we have implemented the following changes in the operation of the town of Wytheville departments and services in order to continue to provide services while practicing social distancing. This includes the closure of many public offices and buildings while staff continues to operate within. The Wytheville Municipal Building is still under normal operations, but we ask citizens to practice social distances and limit traffic into the buildings. Please pay your town-related bills such as taxes, water and sewer, and other fees either online or by phone, or by using the overnight deposit box outside the front of the building. And there are plenty of envelopes supplied to help that work for you. The Wytheville Police Department and Wytheville Fire and Rescue Departments continue to operate as normal. Water and wastewater operations continue as normal. And I will say that the water, our water, is safe to drink. I've had many questions about that. There's not a lot of information about drinking water, but it is said that the virus is very responsive to Clorox bleach, and that is part of our protocol. And as you well know, we have had very good annual gold ratings as far as our water department goes. The refuge collection schedule remains as normal. Wytheville Recreation Center and the 4th Street Civic Center is closed, as well as all associated recreation activities, including games, classes, and Easter egg hunt that was to be held at the park. Town council meetings and the planning commission meetings will be closed to the public audience. The meetings will be live streamed on the Town of Wytheville Facebook page. The E. Lee Trinkle Regional Visitor Center is closed to the public. The Wytheville Meeting Center is closed. All Town of Wytheville museums, to include the Rock House, Thomas J. Boyd, Great Lakes of Florida, and offices are closed. And we will update this listing as it unfolds. We must take this pandemic situation seriously. As the governor said, we all have a role to play in this. And this is the young adults, and the elderly all have different roles to play in this, and we hope everybody takes this seriously. The following mandates have been set forth locally by the governor of Virginia, and some of these mandates are no gatherings greater than 10 people, which this also includes restaurants. We have a fair number of restaurants in our area that are going to be open for business. They will be doing takeouts, they will be doing curbside, and some of them will be doing delivery. We have posters that we are helping with for our businesses that are similar to this, so look for these posters as you drive by, and that might help you find these restaurants. We want you to continue to eat. We want you to continue to eat out if possible. Just look forward for updates and comprehensive lists as far as these restaurants go. The government, we must also take care of our families, our friends, our neighbors, especially the elderly. For the young adults out there, and I have 3 at my home, they think they're invincible. The young adults are people who are probably shedding the virus unknown to other people, and that's why it's important that you play that role that the governor has asked us to do. So wash your hands, keep the social distance between your friends, your groups, your families, keep your parents, your grandparents, your neighbors, your church family, all of that in mind. We all need to do our job. We all have a role to play. This is an excellent time to use technology to pick up the phone or send a message to an elderly neighbor. Check on them. Find out if they have contacts. See if they have their medications. See if they have food available. We need to get this all in place prior to any breakouts that will occur in our community. So what can we do to prevent the spread? Practices, as we all know, is good hygiene, no handshaking. Please do not touch your face. Wearing gloves may help. Put your hands in your pockets. Cross your arms. Things of that nature. Do not sneeze or cough unless it's into the elbow of your arm. If you have a tissue that you sneeze or cough into, please dispose of it immediately. Regularly disinfect your common areas to include your doorknobs and your desks and your tables and your handrails. This is doorknobs in your cars and your vehicles as well, if you are allowed to be out. We know that at this point that the governor has asked the ages of 65 and over who have health issues, to include such things as COPD, heart disease, diabetes, immunosuppressed disorders. All these people are at high risk, and even if they're not 65, they should be considering at this point doing self-quarantine. Avoid unnecessarily travel, especially to areas or groups of people there will be more than 10. And increase the ventilation and opening windows when possible will also help. I want to thank you for your assistance and cooperation. I want you to look and watch for updates as needed. I also will be on the radio at a regular time on Fridays and Wednesday mornings at 8:15 in the morning. So please tune into that for also updates as this unfolds on us. I do want to put people at ease as far as our medical community and our hospital. I have talked with many of the offices, the doctor's office, the providers. They are all have their protocols in place. The hospital is now down to one entrance, and that entrance is the emergency room entrance. They are allowing only one healthy person per visit for patients in the hospital. When you enter the emergency room, they have a table set up and they will screen you. They will take your temperature and they will ask you these questions, and they will get your contacts in case they need to be in touch with you before. They are ready, but as this unfolds, we don't want them to have a rush of patients. So if you feel like you have had contact, or if you feel like you have symptoms, which would include at this point, narrow down to a fever, and it has been stated on national TV that a fever for the 65 and older is now 99.6 as opposed to 101, as we all know. In school systems, that's the guidelines that they use. So fever, dry cough, difficulty breathing. If this is in regular working hours, obviously call your provider. Talk to them about it, get something in place as far as that concerns. If you think you have a 911 situation, do not hesitate. But I do want you to know that the 911 board will be asking you some of these same questions. What are your symptoms? So that when the emergency medical services people come out to your home to take care of you, they will be dressed in protection outfits. They're called PPEs, and they will have mask, eyewear, and a suit on. This is not to scare you, but this is for your protection as well. And they will also put a mask on you, and they will take care of you and transport you where you need to be. The hospital and your providers want you to know that right now, influenza A and influenza B are very prevalent, as well as strep throat still going on in our community. So you will be tested for those first. And all of those will cause you to have a fever. So again, don't panic. We have not had any positive cases determined in Southwest Virginia at this point. Personally, I believe it will be coming. I know we live in a great area, and I know a lot of my friends and a lot of the community people think that, that we are safe. I don't think we are going to avoid this situation. So the virus will be here. And if we take all these steps now, we can make it safer for everybody. We can decrease the amount of positive cases. The hospital does have some test kits available, very few, and they're very few and hard to come by at this point. So Richmond is, in the health department, is in charge of that and who gets tested and so what. Somewhat. The testing that we are able to do here will go to Richmond, to some state labs. Those state labs right now have about a 24-hour turnover. It doesn't take that long to do the test, but by the time the results are back. But the more people that are tested, that's going to slow down. So I want everybody to be aware. Don't panic. We all have a job to do. Play your role, and we will get through this together as a community. We will take care of ourselves, we will take care of our neighbors, and we will take care of our businesses, and we will take care and work through this together. So thank you for listening, and stay tuned for updates as this unfolds on a daily basis.